Migraines aren't just headaches, and if you're an adult who deals with them, you already know how life-stopping they can be. But what if understanding a few key facts could help you spot triggers sooner, find relief faster, and prevent attacks before they even start? In today's video, we're breaking down exactly what every adult needs to know about migraines. Clearly, simply, and in a way that can truly help. Stay with me, because this information could change the way you manage migraines forever. Let's start with the basics. What exactly are migraines? Migraines are more than just headaches. Unlike a regular headache, they often come with a variety of other symptoms that can affect your daily life. They can occur in people of all ages, from children to adults, but they are more common in women than in men. Hormonal factors play a big role, which is why many women notice changes in migraine patterns over time. Most migraines start off as a mild discomfort, almost like a warning sign that something is coming. But if left unchecked, they gradually become more intense, sometimes making it impossible to focus on work, school, or even simple daily tasks. Because of this, migraines can significantly impact concentration, productivity, and overall quality of life. They're not just a nuisance, they're a real neurological condition that deserves attention and proper management. Now let's talk about the symptoms of migraines in adults, because understanding them can make a huge difference in how you manage them. The most well-known symptom is a throbbing headache. Unlike a regular headache, a migraine headache often gets worse over several hours. It can start mildly, but if ignored, it may intensify and disrupt your entire day. Many people notice that migraines often affect only one side of the head, though sometimes both sides can hurt. Migraines don't stop at pain. They can come with nausea and even vomiting, making it hard to eat or drink. And sensitivity to light and noise is common. This is why lying down in a dark, quiet room often provides relief. It helps your body and brain cope with the overwhelming sensory input. Recognizing these symptoms early can help you take action sooner, whether it's resting, using medication, or avoiding triggers, which can make a huge difference in reducing the intensity and duration of a migraine. Some adults experience something called a migraine aura, a set of symptoms that can appear before or during a migraine. The most common effect of an aura is on vision. You might notice flashing lights, bright spots, or zigzag lines, and in some cases, even a temporary loss of part of your vision. But it's not just the eyes. A migraine aura can also include numbness or tingling, often in the lips, lower face, or fingers on one hand. Some people even hear sounds or experience ringing in their ears as part of the aura. These symptoms are usually short-lived, lasting 15 to 30 minutes, though they can occasionally persist for up to an hour. Here's an important medical note. Women who have migraines with aura usually cannot take certain birth control pills, because doing so can increase the risk of stroke. Understanding aura is crucial because it helps you recognize a migraine early, prepare for it, and discuss safe treatment options with your doctor. Before a migraine headache even begins, some people experience what doctors call premonitory or prodromal symptoms. Think of these as your body's early warning signs, clues that a migraine may be on the way. These symptoms can appear anywhere from a few hours to even a day before the headache hits. Paying attention to them can help you take action early and possibly reduce the severity of the migraine. Common premonitory symptoms include 1. Yawning more than usual, almost like your body is telling you to rest. 2. Feeling depressed or irritable, which may seem unrelated but is actually linked to migraine changes in the brain. 3. Food cravings, especially for certain types of snacks or sweets. 4. Constipation, which can be an overlooked early sign. And 5. A stiff neck, making movement uncomfortable. Recognizing these early signs gives you a head start in managing your migraine, whether that's resting, taking preventive measures, or adjusting your environment to reduce triggers. It's like your brain is sending you a little warning light. If you pay attention, you can respond more effectively. You might be wondering, is there a test to diagnose migraines? The short answer is no, there isn't a specific test that can confirm a migraine. So how do doctors figure it out? They rely on a combination of careful examination and listening to your story. First, your doctor may perform a physical and neurological exam to make sure nothing else is causing your headaches. They'll check things like reflexes, muscle strength, and nerve function to rule out other conditions. Next, they will want to learn about your symptoms and your headache patterns. Questions might include: how often do migraines happen? How long do they last? What makes them better or worse? Here's the key: the clearer and more detailed your description is, the easier it is for your doctor to make an accurate diagnosis. So keep track of your headaches, triggers, and any associated symptoms. It can make a huge difference in getting the right treatment. If you're dealing with migraines, you might wonder, should I just wait it out, or see a doctor? The answer is simple. Yes, you should talk to a doctor or nurse if you suspect you're having migraines. Seeing a healthcare professional is important because they can help confirm the diagnosis, rule out other conditions, and guide you to effective treatment. You should especially seek medical care if 1. Your migraines are becoming worse over time. 2. They are happening more frequently than before. And 3. You notice new or different symptoms that you haven't experienced before. Don't ignore changes in your migraines. Early evaluation can prevent complications and help you get the right treatment faster. Remember, your doctor or nurse is your ally in managing migraines safely and effectively. Now let's talk about something everyone wants to know: how to prevent migraines. The good news is that for many people, migraines don't just happen randomly. They can be triggered by specific foods, habits, or conditions. By identifying and avoiding your personal triggers, you can significantly lower your chances of getting a migraine. But how do you figure out what those triggers are? One of the most effective tools is a headache calendar. This is a simple log where you write down: 1. When your migraines happen. 2. What you ate or did beforehand. And 3. Any medicines you took and whether they helped. Over time, this calendar can reveal patterns that help you predict and prevent future attacks. It's like having a personal blueprint of your migraines. Once you understand your triggers, you can take proactive steps to reduce both the frequency and severity of your attacks. Understanding what triggers migraines is one of the most powerful tools in preventing them. While triggers can vary from person to person, there are several common factors that are known to spark migraine attacks. Stress is a major culprit. Emotional or physical stress can overload your nervous system and set off a migraine. Hormonal changes, especially in women, can trigger migraines. This is why some notice patterns around their menstrual cycle. Skipping meals or not eating enough can also lead to an attack, as drops in blood sugar affect brain function. Weather changes, including shifts in temperature or barometric pressure, can be a surprisingly common trigger. Sleep patterns matter. A lack of sleep, too much sleep, or irregular sleep schedules can provoke migraines. Bright or flashing lights can overstimulate the brain and trigger an attack. Alcohol, particularly red wine, can be a trigger for many people. Certain foods and drinks, like aged cheeses, hot dogs, or caffeinated beverages, can also play a role. Remember, each person's triggers can be unique. That's why keeping a headache calendar to track what you ate, how you slept, and your stress levels can help you identify your personal migraine triggers and take steps to avoid them before they strike. Prevention doesn't stop at avoiding triggers. Your doctor can help you take additional steps to reduce the frequency and severity of migraines. Some strategies your doctor may recommend include 1. Relaxation techniques, like deep breathing, meditation, or gentle yoga, which help calm the nervous system and reduce the likelihood of an attack. 2. Stress management strategies, because stress is one of the most common migraine triggers. Learning how to manage daily stress can make a big difference. 3. Preventive medicines, which are designed to reduce how often migraines happen or lessen their severity. These are especially helpful for people who experience frequent or severe attacks. 4. For women who notice migraines around their menstrual cycle, there are also medications and strategies that can help prevent these period-related migraines. The key takeaway: by combining lifestyle strategies, stress management, and medical guidance, it's often possible to take control and significantly reduce the impact of migraines on your life. When it comes to treating migraines, there are many different medicines available, but the right choice depends on your symptoms, frequency, and overall health. That's why it's important to work closely with your doctor. They can help you find the best treatment for your situation. For mild migraines, often the first step is over-the-counter medicines. These can be very effective when taken early in an attack and include 1. Acetaminophen, commonly known by the brand name Panadol or Tylenol, which helps reduce pain. 2. Ibuprofen, with brand names like Brufen, Advil or Motrin, which can reduce both pain and inflammation. And 3. Naproxen, also known as Aleve, which works in a similar way. There's also a combination medicine that many people find helpful: acetaminophen, aspirin, and caffeine, sold under brand names like APC or Excedrin. This combination can provide faster and stronger relief than a single medicine alone. Remember, taking these medicines at the first sign of a migraine often gives the best results. And always follow your doctor's guidance on dosage and timing to stay safe and effective. When migraines become more severe or frequent, over-the-counter medicines may not be enough. In these cases, prescription medications can make a big difference. One common option is triptans, which are specifically designed to relieve migraine pain quickly. They work by targeting the underlying neurological changes that cause migraine symptoms. Other prescription medicines can help reduce how often migraine attacks happen, which is especially important for people who suffer from frequent or disabling migraines. For those who experience severe nausea or vomiting during a migraine, there are medicines available to help control these symptoms, making it easier to stay hydrated and maintain nutrition. Important reminder: if you have frequent migraines, do not rely on non-prescription pain medicines on your own. Taking them too often can actually lead to more headaches over time, a condition known as medication overuse headaches. Working closely with your doctor ensures that you get the right combination of treatments to manage your migraines safely and effectively, without causing additional problems. If you're planning to get pregnant, it's important to talk to your doctor or nurse before you start trying. This is especially true if you take medications for migraines, because some migraine medicines are not safe during pregnancy. In many cases, your doctor may suggest switching medications ahead of time to ensure both your safety and the baby's health. Interestingly, many women notice that their migraines actually improve during pregnancy. This is linked to hormonal changes that can temporarily reduce the frequency or intensity of attacks. Migraines can also get better during breastfeeding, again due to shifts in hormones and the body's natural rhythms. By planning ahead and working closely with your healthcare team, you can manage migraines safely while preparing for pregnancy, making this exciting time as comfortable as possible. And that's a wrap on everything you need to know about migraines in adults. Let's quickly recap the key points. 1. Migraines are more than just headaches. They can affect vision, cause nausea, sensitivity to light and sound, and seriously impact your daily life. 2. Recognize the early warning signs, including aura and premonitory symptoms, so you can act fast. 3. Understanding your triggers, from stress and hormonal changes to certain foods and sleep patterns, can help prevent attacks. 4. Keeping a headache calendar and working with your doctor is essential for both prevention and treatment. 5. There are safe, effective medicines for mild and severe migraines, but always follow your doctor's guidance, especially if you're planning to get pregnant. If you found this video helpful, please hit the like button, share it widely with others who might benefit, and subscribe to our channel for more practical health tips. Don't forget to hit the notification bell so you never miss an update. And we'd love to hear from you. Comment below and tell us about your experiences with migraines or any questions you have. Sharing your story could help others in the same situation. Thanks for watching, and remember, understanding migraines is the first step toward managing them and reclaiming your life. I will see you in the next one.